Hey everyone, my name is Danielle Palmer. I'm a neuromuscular therapist and also the Scenar Therapist here at the Center for New Medicine. So today I'm going to be telling you a little bit about how Scenar works. Scenar stands for Self-Controlled Energy Neuroadaptive Regulation, and that is very big terms for basically it speaks the same language as your body's central computer. Every millisecond, Scenar is sending out a new impulse that's corrective, and it's actually negotiating with your body for the highest rate of change. Scenar is FDA Class 2 for acute and chronic pain, and overall it brings the entire body back into homeostasis. Some of the benefits of Scenar include bringing the entire body back to homeostasis. When your body's back at homeostasis, you tend to do better at healing, you have more energy, you have better functions within your body, and overall, you're going to be in better health. So getting your nervous system back in line is vitally important to not only battling any sort of ailment, but also any sort of pain. Today I'm going to be demonstrating a little bit about how Scenar works and what you can expect during a session. So Scenar was actually developed in Russia, and it was developed by Professor Alexander Ravenko and Yuri Gorfinkel, as well as Alexander Karasov. So these three inventors actually created this device over 40 years ago. And in those 40 years, there's never been any adverse side effects because Scenar actually works naturally with your body. Your body's actually in control of the session. Scenar will push it, but only to the point where your body will allow. And because of that, that's why we haven't had any adverse side effects. So as far as the Ravenko Academy goes, I'm one of two practitioners here in the United States that have the training that I do. The other one being Professor Alexander Ravenko's daughter, Dr. Elena Sabatina. And other practitioners around the world, we all get together and we combine our experiences with protocols and with success with many issues. So we have access to therapists in Italy, in France, in Germany, and everywhere around the world. So if I can't figure it out, there's going to be a therapist out there that can. So typically with any Scenar session, we always start working on the spine. So first I'm going to check a few places just to see where she feels it. Now during a session, you're going to feel just a slight little tingle, maybe a little bit of a vibration, but nothing painful. So let me know just when you start to feel that little tingle or a little poke, okay? A little bit? Mm-hmm. Perfect. All right. So like I said, every Scenar session usually begins along the spine. The reason for that is because we work with the central nervous system, sympathetic and parasympathetic. Everything within the body always starts right here. So if at any point it gets too strong, you just let me know. And so what you'll notice when we work with Scenar is that on certain areas of the body, the device is going to slide very cleanly. But in certain areas, it's actually going to be a little bit sticky. And those are the areas that we pay attention to. Those sticky areas indicate areas where there's a lot of information that's collecting on the skin. So for you, it seems to be right up here. So you feel how it's kind of sticky right there? Yeah, and then it kind of glides a little bit easier. So I can already tell with her that I'm going to work right along the neck here, just to start. And how's that feeling? Is that painful at all?
Nope.
Session should always be very comfortable for you. If anything hurts, we always want you to let us know. Another way that we're actually able to tell where we need to work along the body is we actually get a number readout. So I'm going to switch into a different mode right now. And what this is doing is basically measuring the speed at which your nervous system is responding. So the areas that are responding faster are my fastest messengers. So I want to send the corrective information with them. Now during this process, every millisecond, Scenar is sending out a new impulse. And during this particular process, it's actually negotiating with your body for the highest rate of change. So Scenar goes in demanding within 10 seconds, 100% back to normal signaling. If your body can't do that, then it will extend the time allotted and lower the expectation. Because of this, there's never been any adverse side effects reported in over 40 years. And that ring right there just indicated that we reached an agreement with her body. So during a Scenar session, we always focus on the holistic approach. We do everything from informational correction, informational cleansing, energy correction, energy cleansing, as well as protocols for many other issues throughout the body. Obviously, our main focus is always pain, but the way that Scenar works, bringing the body back to homeostasis, can have many other benefits. So throughout the treatment process, you're going to be hearing different beeps and different alarms going off on the device. The reason for this is because we're checking initial reactions within the body, so we're checking speeds. And among those highest speeds, like that one, we're actually putting what we call a dose. Now the dose is basically an agreement between Scenar and your body. And then we compile all the doses and we get the next step, which is what we call a zero. During that process, we'll either leave the machine on the same spot for 2 minutes or until it indicates to us that it's produced as many mediators as it possibly can in that area. Scenar is working through the chemical mediators of the body, so it's actually controlling and bringing back into balance all of the chemical production. And that controls everything from inflammation, mood, pain, and many other things. So in preparing for a Scenar session, you don't really need to do anything to prepare other than just making sure that you don't fall under any of the contraindications. So contraindications for Scenar are no pacemakers and no pregnancy. Now after a session, some people will experience a little bit of a feeling like euphoria. We Scenar therapists lovingly refer to this as Scenar drunk, but that's kind of a joke amongst us therapists. You might feel a little lightheaded, you might feel a little woozy. That's totally normal, and usually it doesn't last too long. So after a Scenar session, no lotions and no showers for 2 hours. Now Scenar is very well received when pairing it with massage, but what we say is please wait about 2 hours after your session because we don't want any interruptions with the signaling process. Because after I'm done with you, for 2 hours, this is still actively treating you. Most people actually will experience changes over the next few days as well. Some people, they'll experience changes right off the table. Some people it will be 24 hours, some people 48 hours, some people even 72 hours. So it's all about how your body takes this and receives it. So here at my time at the center thus far, I've been able to work on quite a few patients. And some of my favorites have included post-surgical nerve damage repair, as well as keeping stage 4 patients out of pain. Some that have masses and no other pain management has worked. With them, Scenar has been an absolute dream and it's kept them out of pain. Well, while I'm busy waiting for zero, I am going to bid you adieu. Thank you so much for joining us today, and I look forward to seeing you. If you have any questions whatsoever, leave them in the comments down below, or reach us here at the center, and I look forward to seeing you.